Hi, I'm here with my friend
Hello.
Rana, and she's got her dogs Nigel and Ike is somewhere. And Nigel here is the dog that we're going to be working with today. And we're going to go over Rana's questionnaire. And let's just go over each of the points. That Nigel is his name. He has been microchipped. He's 3 years old and a rescue. And we'll talk about his history a little bit in a minute. I want you to describe that to me. He's a Labradoodle, a male neutered. And he eats twice a day. He eats dry food with some cooked meat. He takes no supplements. He is very friendly. He doesn't bite. He gets a little wound up. Sometimes he gets a little anxious and wild and barky, which is, we're going to work on that today, but he does not bite. He was vaccinated and dewormed 6 months ago. And he's never had any surgery except to get neutered. He has no injuries, no allergies. He, once in a while, rarely has some itchy skin. Nothing at this time, and no scars, no wounds. He is not taking any medication or remedies of any sort. And Rana's concern is about his anxiety. He has exhibited anxiety since the first day he walked in this house. Rana, why don't you go ahead and tell me a little bit about his history and how he's been since you've had him, and why it is that you want to try to see if we can work on his anxiety levels.
Well, we got Nigel when he was a year old, and he was taken from a hoarding situation. We believe that he was caged most of the time, no socialization at all. And so we had to kind of work with him on that. He was very friendly from the first time we got him. But I noticed a lot of anxiety when I would leave his side. If he was next to me, he was fine, but if I was away, he was very nervous.
And tell me about that first day when you got him, when you brought him home. I think it was the first day when he escaped.
Oh, yeah. Well, I went out for about an hour, and then he ended up going to the backyard and jumped a fence and ended up in a swimming pool and almost drowned the first night. He just had to get away. I don't know if he was looking for me or what he was doing, but he was just had to escape.
Yeah. And you've said that, for instance, if you pick up your phone, he wants to knock it out of your hand.
Correct.
He wants all the attention for himself all the time.
Right here, where you see him next to me at all times. Right here.
The top of his head is here.
Here he is.
So, okay, so what we're going to do today is we are going to work with Nigel with photonic therapy. And what I wanted to do is familiarize you with that a little bit. And if you have questions, I'll be more than happy to answer any of those. And I like to use the photonic therapy brochure because it's a visual for people to look at. And I can leave this with you just so that you can have some information for yourself. And basically what it is, it's doing acupuncture without needles.
Sounds fantastic.
And that way you're not scaring a dog, especially somebody that's a little anxious like Nigel is. It's pain-free and it achieves the same result.
Okay.
And what we're looking to do, as it says here in the brochure, it reduces pain, it definitely boosts the immune system. So even if you have a dog that doesn't really have anything wrong with them, we can keep their immune system in tip-top shape so they don't ever get anything wrong with them.
Oh, that's good.
And it releases serotonin. Nigel could use that for sure. It relaxes muscles, it promotes healing, it takes away pain, etc., etc. And listed here, now this one is for horses, all the conditions that it can work with. I brought along a sheet here that shows all the things that this can be used with dogs. So anytime in the future, if you have a situation with your dogs or friends' dogs that you want to refer to me, we can cover all of this kind of stuff.
Oh, that's great.
With the red light therapy. So it's really amazing. And what we do is we're going to analyze his gait so we can make sure that his body is moving correctly. And then we will start by using the red light. And this is what it looks like, almost kind of like a flashlight. And it's just a red light. It's cold. There's no heat to it whatsoever. It doesn't hurt. You can tell, you can feel it. There's nothing happening there.
No.
And I'll introduce this to Nigel in a minute. And there are 12 standard points that we work on with the dog on both sides of his body. And I just brought this sheet so you can skim through it at your own leisure. But basically what this does is it works on for instance, fear, aggression, epilepsy, prolapse of the rectum. It works on muscles, tendons, ligaments, bones, nerves, circulatory system.
Wow.
These 12 points really work on everything in the whole body.
That's amazing.
And so when these are done on a regular basis, again, you're building that immune system, you're hitting every system in the body to make it work properly.
Okay, how often do you have to do it?
So with a dog like Nigel, since he has been anxious ever since you've gotten him for the past 2 years,
Right.
we're going to do work on Nigel every other day for 2 weeks. And at that time, I'll reassess how he's feeling. I'll sit down and talk with you again, and you'll be telling me, I'm seeing some improvement, I'm not seeing any improvement, and we'll go from there. More than likely, you will definitely be seeing some improvement, but it's not going to be, since it is chronic. We may need to do this every other day for possibly 4 weeks or maybe a little longer. If we start to see real fast improvement, which would be awesome, then we can cut back from every other day to maybe every 3 days, then go to twice a week, then go to once a week, etc.
Okay.
So we just have to go with the flow and see how he does. And with feedback from you, I'm available by phone, by email, by text. Anytime you have a question, you can give me a call. And I just wanted to show you also too. So what Dr. Brian McLaren is the veterinarian from Australia who developed this system. He has since passed away and passed his knowledge and his system on to my teacher. And so what he's done, so that this is something that anyone can learn how to do, is he's made like a recipe book basically.
Oh.
So that the standard points that we discussed, those 12 points, so he literally has pictures that you can just follow along with.
Oh, that's great.
And there's a huge amount of specific points that he has developed with all of the conditions that I showed you earlier that look just like this, so that you could actually purchase your own torch or rent one from me and actually be taught how to do this yourself if you like it in the future. Or, you can have me come and do it for you. So it's really well researched, it's really well mapped out, and it's something that's very easy and very quick to do.
Okay, good. Sounds good.
All right, so
Great
we're going to go
program.
ahead and we're going to get outside and we're going to videotape his gait, then we'll come back in and discuss that and we'll torch him.
Let's do it.
Okie dokie.